Deep vein thrombosis, or DVT, is a blood clot that forms in the deep veins in the body. Blood clots form when blood cells and blood components stick together. Most deep vein blood clots occur in the leg or thigh, however they can occur in other parts of the body such as the arms, chest or neck. If untreated, part of the clot in a deep vein can break off and travel to the lungs, blocking blood flow. This can be potentially fatal if not detected early. Symptoms of a deep vein thrombosis can include swelling, pain, cramping, or a warm feeling of pressure. These symptoms will be focused in the affected area like a foot, arm, leg, or in the neck. Sometimes, however, DVT has no symptoms at all. Some people are at a higher risk of developing deep vein thrombosis. Risk factors include being admitted to hospital, having or undergoing cancer treatment, being pregnant or having had a baby less than 6 weeks ago, being immobile such as bed rest, long distance travel, or having a limb in a cast or boot, family history of blood clots, having had surgery less than 90 days ago, thrombophilia, some kinds of contraception containing estrogen, heart, lung, or inflammatory diseases, being over 60 years of age or overweight. The most common treatment for DVT is through anticoagulants. These are medications that prevent clots from moving, growing, or forming altogether. These can be taken for short-term treatment or for a longer time. You should take your medication until your doctor tells you to stop. Compression stockings can also be used to help reduce symptoms of post-thrombotic syndrome like leg swelling, pain, or ulcers. The main side effect of anticoagulant medication is an increased risk of bleeding. Make sure to contact your doctor if you notice heavy menstrual bleeding, unusual extensive bruising, or unexplained tiredness or a very pale appearance. If you experience a traumatic injury like hitting your head, or if you notice blood in your urine, in your stools, or when you cough, or if you experience a bleed that won't stop, you must attend the emergency department. Treatment for clots is very effective and safe, and the vast majority of patients experience minimal or no side effects. There are things you can do to speed up recovery, like taking your medication as prescribed, drinking plenty of water, starting physical recovery as soon as your doctor recommends, and remaining active every day. If you smoke, you should stop. Most patients can return to normal life as before. However, if you play contact sports, you should discuss this with your doctor.